Hello everyone, thank you for having with me. I am excited to present our scoping review titled Digital Health Technology Infrastructure Challenges to Support Health Equity in the United States. This work was published in the Journal of Medical Internet Research in 2025 and represent a collaborative effort across multiple institutions. So let's me begin by introducing the team behind of this research. This study was conducted by a diverse team of researchers and public health professionals from the institution, including the University of Memphis, Clemson University, Marymount University, and the Shelby County Health Department. M. Shankar Roy, a doctoral student and graduate research assistant at the University of Memphis. Now, let's explore why this topic is both timely and critical. Our review will focus on how digital health technology, health infrastructure affected health equity in the United States. We identified major barriers such as limited broadband access, low digital literacy, and systematic healthcare challenges. This issue became even more relevant during the COVID-19 pandemic, which accelerated the adoption of telehealth in the United States. So, to better understand the scope of this published research, let's look at the digital health landscape in the United States. So, the main overview of the digital health technology is actually increasing day by day, and use of technology is also helpful for public health advancing. However, there is some disadvantage of digital health technology uses in the United States because of some disadvantaged populations are actually not fully use of the digital health technology for the different type of barriers. This actually create more inequitable access among the community populations. Those are disadvantages, and also addressing these inequalities is a critical increasing populations benefit quality from the digital health solutions. Digital health encompasses several technology, and we notice that at electronic health record, telemedicine, and mobile health are basically used more frequently. We found in the literature review. These tools are designed to improve care delivery and access, but disparity in infrastructures and adoption limit their effectiveness. That is why the objective in our research related to these infrastructures. Now let's look at the objective of our review paper. So our goal was to synthesize evidence on infrastructure challenges, highlight barriers faced by both patients and also provider, and map how these gaps contribute to health disparities. Ultimately, we aim to improve future research and policy interventions by the conducted of the scoping review. We conducted a scoping review using ArcSci and OMELI framework, analyzing 628 research papers published between 2022 and 2024. After applying inclusion criteria, we found that 27 studies were selected. These included are quantitative, qualitative, and mixed method research. Let's dive to the key findings with starting with the patient level inequities. So, if the key factor leading to health inequalities, we found that older adults face barrier due to declining sensor and cognitive function. Black communities show lower adoption rate of digital health tools. Socioeconomic status and geographic location also play major roles. Rural areas specifically struggle with broadband access. And for the patient and without a smartphone or computer are less likely to benefit from telehealth. So technical difficulties and lack of digital literacy further widen the gap of health equity. Now let's examine the challenges faced by the healthcare provider. So we found that healthcare provider have different challenges from the scoping review. Provider encounter workflow integration issues, technical barriers, and staffing shortage. Additionally, racial bias embedded in electronic health record can influence treatment decisions and perpetuate disparities. There is also, we found that system level challenges in this scoping review. Among nearly 3,000 hospitals, 73% had implemented at least one digital health capability. However, adoption was uneven, especially for non-profit and teaching hospital lead the way, while investor-owned facilities lagged behind. So there is a need for resource allocation and facility closure also impacted for this access. And we also see that infrastructure barrier using the limited broadband in rural areas, lack of devices, low digital literacy, and cultural barrier all contribute to inequitable access. And there are some paper we have found that non-English speaker and underserved population are particularly affected for the health inequity for the using of digital health technology. These challenges are actually interconnected and disproportionately affect vulnerable populations. While policy like the Affordable Care Act aim to address these issues, gap remains. So our finding reinforce the need for system-level challenges to ensure equitable digital health access. So finally, let's look at the path forward, what we have proposed in this scoping review. For the path forward and key takeaway from this paper is that to achieve digital health equity, we must expand broadband access, enhancing digital literacy, and improve provider assistance. And we also thought that pragmatic solutions can help ensure that all individuals benefit from digital health innovations and decrease the health, health inequalities for all the populations. Thank you for your attentions. So, I am PhD candidate in epidemiology at the University of Memphis. So, feel free to reach out to me if you have any questions. Thank you very much.